Now that we've discussed procedural sedation as well as the possible alternatives, I'd like to discuss with you some of the possible complications associated with procedural sedation.
Okay.
There are three serious possible adverse events that can occur during procedural sedation. These are laryngospasm, the need for intubation, as well as aspiration. The first is laryngospasm. That's a term used to describe when the medication causes your vocal cords to clamp together, preventing you from breathing. The second serious possible complication would be the need for intubation. If you had a prolonged period of time where you weren't breathing, we would potentially need to place a plastic breathing tube down into your trachea to help you breathe for a short period of time. The third possible serious adverse complication from procedural sedation would be aspiration. That's a term used to describe when you vomit during the sedation and some of the vomit actually goes down into your lungs, which could cause difficulties with breathing after the sedation. Fortunately, these three serious complications are all exceedingly rare, in total occurring in less than 1% of all procedural sedations. In addition, there are a few other possible side effects that can occur during procedural sedation. One would be low oxygen levels or hypoxia. This occurs in about 5% of all procedural sedations. If you do have low oxygen levels, we would provide you with supplemental oxygen during the procedure to keep your oxygen levels normal. In addition, you may have short periods of time where you have shallow breathing or stopped breathing altogether. Again, we're monitoring you closely during the procedure to ensure that this doesn't occur for a prolonged period of time, watching you both on the monitor as well as with your oxygen level. In addition, some patients experience a low heart rate or low blood pressure. Lastly, some patients after the procedural sedation experience nausea, vomiting, or agitation. Do you have any questions about procedural sedation?
You said some people stop breathing. How often does that happen?
It's a good question. It occurs in about 2% of all procedural sedations, or about 20 out of 1,000. Again, this is generally something that's very transient, and we watch you carefully on the monitor both for your breathing patterns as well as your oxygen levels to ensure that we're not running into any serious side effects from this.
Okay. You also mentioned nausea and vomiting. Is that really common?
Another good question. It's not very common, occurring in approximately 1% of all procedural sedations, or about 11 in 1,000. Do you have any other questions?
No, I think you covered everything.
Okay, then shall we proceed with the sedation?
Sure.